Welcome to the Birth Boot Camp podcast, your trusted guide on your journey through pregnancy, birth, and beyond. I'm Holly, your host, along with Cheryl, Megan, and Liana that make up the Birth Boot Camp headquarters team. Together we are here to explore the amazing world of childbirth and family wellness. Each week we'll dive into empowering conversations with expert guests and share practical insights and heartfelt stories to support you on your unique path to parenthood. Whether you're expecting your first baby, you're a seasoned doula or childbirth educator, or simply curious about the miracle of birth, you're in the right place. Together, we'll celebrate the beauty of birth, honor the strength of motherhood, and embrace the joy of new beginnings. So sit back, relax, and join us on the Birth Boot Camp podcast, where every birth is amazing, every family is supported, and every story matters. Hello, everyone, and welcome to today's episode of the Birth Boot Camp podcast. I'm Holly, the CEO.
I'm Cheryl, the certification coordinator.
I'm Liana, the administrator.
And I'm Megan, the head of marketing.
And today, well, for one, all four of us aren't usually on. So it's usually a couple of us and if we have a guest or something. So I'm really excited for all four of us to be on today. It's going to be a lot of fun. And we are talking about, we have 5 common myths that we hear on TikTok or social media. And we find that we are always talking about them on Marco Polo. And I was like, you know what, we should chat about these on our podcast because I don't know, they're ones that kind of get us excited and we're like, that's not true. So
by excited, you mean riled up.
Yes, that's what I was trying to say. That's where I was trying to go with it. So yeah, we get riled up about some things. And so we have a list of 5. We've already been thinking about others that I'm like, we'll probably do a part 2 at one point. But I guess we'll just kind of go down the list and kind of share. So the first one is one that I get riled up about, and it's been bugging me for a while. And I heard it at a chiropractic conference again this past weekend. And I was like, no, that's not true. And that is this idea that we hear on social media a lot, is that after baby's born and the placenta is delivered and during your postpartum recovery, is that you have a wound on the inside of your uterus that is the size of a dinner plate. And it's just not true. Right. And when that first started circulating a couple of years ago, I was like, that just doesn't even make sense. Because your placenta immediately after birth begins to shrink down. Yes, the placenta, I think they say on average is about, I was thinking the placenta is about 9 to 10 inches in diameter. So yeah, that's the size of a dinner plate, but it immediately begins to shrink down. It does not stay that size.
It doesn't. Yeah.
Yeah, it just doesn't.
The placenta, the place where the placenta was attached to the uterus, you mean, that starts to shrink down, and that,
yes.
Right.
Yes. All of it. It's so immediate.
I think that's the biggest thing, that they're just missing the second part of that. You know what I mean? Yes, you do have a wound, but the immediate fact is that it is shrinking down and getting smaller. And so you're not walking around for 4 to 6 weeks with this giant hole in your body. It's just not the case. Because and that's how they make it seem. And I'm like, okay, that's incorrect. And people, we would be bleeding out if that were the case.
Right.
So.
Right. Yep.
Right. Well, and the placenta site gets smaller because the uterus is shrinking down. So the uterus shrinks down, and that's what causes the placental site to also shrink, to cut off all those blood vessels so that you don't bleed out. So yeah, that doesn't, if you think about it for 10 seconds or 2 seconds, and if you know the way that the uterus works, then that's clearly not accurate.
Mm-hmm. Yep. And I think the idea behind it of yes, we should be resting postpartum. Right. Obviously, yes, that's all good things. We all know that. And the more you rest postpartum, the faster your recovery will be. It's, you're more likely your bleeding's going to get better the more you rest, things like that. That's all great. We agree with that. Mm-hmm. But I don't you have this big, huge wound in you for weeks after birth. It's just not true. I remember when that first started going around, I remember posting on my personal Facebook page of like, okay, all my midwife friends like chime in here. I was like, is this true? Like, what are y'all's thoughts about this? And they all kind of said the same thing. They're like, no.
Yeah. I
Yeah.
always tell people like it's small but mighty, like it still needs to it still has to heal, like even though it's not the size of a dinner plate, it does have to heal, and that does take time, and that does take rest, and that does take all of these things. So like while it's not the size of a dinner plate, it is still a significant wound inside of you that does have to heal.
Right.
So there's like kind of a balance between like you're not healing something the size of a dinner plate, but it is something that still needs to be thought of. It needs to be considered
Right.
as part of your healing process after birth.
Yeah.
Which on the one hand, I mean, if you tell people it's the size of the dinner plate, maybe they'll rest more. But here at Birth Boot Camp, we believe in accurate information. So
I think that that comes down to like the fear tactic of like our ultimate goal is to get women to rest, but like we don't need to scare them into doing that. Like the facts are just rest after having a baby is so important.
Right.
So
yeah, I mean, and we all know that like so many like the rates of like postpartum, hemorrhage and depression and anxiety, like we know that that's a problem in the United States. It's awful. We don't honor that time after birth to rest, and so many people don't have the support to be able to do that. And so it's hard. It like you said, it's like finding that balance. But also sharing accurate information. I just this weekend when I heard a chiropractor say it, I was like, really? I was like,
are we still saying
I
this?
was like, come on. I immediately texted Cheryl and I was like, this has got to stop. So anyways, I know we've seen Dr. Toya that was on the podcast a few months ago, I think it was. She had made a reel about it and she's like, no. I've seen multiple midwives make posts about it too. So it's just not accurate.
I like how Dr. Toya held a plate up to her stomach and was like, guys, this doesn't even fit.
Yeah.
like it's physically impossible for this to be accurate.
Right. Yeah.
Like
when you have a 7-8 pound baby and your uterus is stretched, yes, but not after it shrinks.
Right. Exactly.
Yeah. So that's our first one. This is one that's been bugging us forever. And I was like, we have to talk about this. So, all right. Okay. The next one is just talking about pain in labor. What is the meme that you guys like shared? What does it say? I forget the numbers.
I feel like I'd have to pull it up, but it's something to the fact that women, I feel like it says like man can't live with more pain than like 40 del is what it says, but women in childbirth experience 57 del, and it's like breaking 20 bones in your body all at once. Which is so, first of all, there's no such thing as like a unit of measurement of del. So right off the bat, like that just is false information. And like in all my research, like there's no unit of measurement of that. So, we're not even considering this as fact. And people experience pain in so many different ways. So maybe someone feels like, wow, that's similar to something I felt in the past, like maybe breaking a bone. But like the thing that they're saying is that it's like breaking 20 bones in your body at once. And I don't believe that.
Whether it's true or not, it's not helpful.
Right. That's what I think too.
We talk so much about like we're so focused on the pain in labor, and it's just like there's so much more to it than just this is so painful that you're experiencing more than the human body can usually withstand. The pain in labor, like it's a normal part of the process. And we have
right, breaking your bones isn't supposed to happen.
Right. That like usually every other type of pain that we experience is we look at it as a bad thing. But like in this instance, like this is a normal good part of the process. And like our body is meant to do that. We have hormones in place that can control that. And your body is creating this sensation. It is the hormones are causing your uterus to contract. And I don't know. So that's what I always tell people is like, we have to change our mindset about pain a little bit because this is a normal part of the process. And I think when we look at it that way, we're like, oh, okay. It becomes less scary, more doable.
Well, and I hear so many of my clients and my students talk about their pain tolerance and try to explain to them that this has nothing to do with pain tolerance, because first off, everybody feels contractions differently. Arguably, each pregnancy, you can feel contractions differently. And it's not this, like, it has nothing to do with pain tolerance. I have broken a femur before. And so one of the reasons why I really disagree with the whole breaking bones thing is because you don't actually feel your bone break, because you don't have nerve endings in your bones. So like what you're feeling is the muscle strain that's happening. If your
everything
bone
around
is into your muscle, or if it's compound fracturing, like going out of your skin. But like, that whole meme was it's wrong on so many levels. And yes, while breaking your bone can hurt, like I actually think it's the accident itself that caused the pain, not the broken bone.
That's a really good point. Yeah, I've broken multiple bones in my body. That's what I was known for when I was a kid. So yeah, you're totally right. It's the swelling, it's all the things that happen around it. So yeah, that's a really good point.
Yeah, and that kind of pain doesn't go away though. Like the recovery of a broken bone, that takes a lot of time, and without medication, you're just in pain for a long time until all of those tissues heal surrounding your bone. Whereas labor, it's not like that. It's just not. It might seem like that, especially during transition, but it's not.
Yeah. There's an end, like there's an end and it's going to be over. And people always say that in my class too, about like the pain tolerance. And I'm like, it's so different. And you're getting all these tools and all these ways that you're going to be able to help yourself through the pain of labor. And it's intermittent, and it's, and there are different comfort measures, like it's a completely it's a different setup. It's something that you're anticipating. It's something that is going to happen. You didn't know you were going to break your bone. Like that's, if you knew, then maybe you could set up like, I could have a broken bone team, like that would be weird, but you know what I mean? Like, there are all these things that you're doing to prepare for this thing that is going to happen. It's going to have an end. That there's going to be, like, it's for a purpose. Like breaking your bone, there's no purpose in that. It was just an accident, like you said, like something bad happened that ended up with that. But it has a purpose and it has an end, which I think can change the way that we think about it. It should change the way we think about it because it's different.
Yeah. I like using the PAIN acronym. There's an acronym that I don't know who created it, but the P is this: pain in labor is purposeful. Like you get a baby out of this too. Like you get the best prize ever. So it has a purpose. The A is it's anticipated. So like, it's coming, like even during your pregnancy, you can anticipate it. And so you can be doing things to prepare for it. But even in labor, kind of when you get on a pattern and it's like, I'm contracting every 4 minutes, like you kind of, when it's coming. It's intermittent. That's one thing, like I think Cheryl, you said it, like you get a break. Like, it's not like you're in this pain the whole entire time you're in labor. You get a break between each contraction. And if you actually calculate the amount of time that you are laboring, you actually usually are in that break time period more than you are contracting.
Yeah.
And so I think we often forget about that, especially because of like movies and TV and, you know, and then the end is that it's normal. And it's just this process of changing our mindset about it. And yeah. So
Cheryl, what you said about having a team to prepare for a broken bone. I will say I could have really used a doula when I was getting my leg put into traction.
I'm
yes.
sure.
I could have used a doula. I was 19. I had no idea what a doula was, but I could have used one.
Yep. Absolutely. Well, I think even like a lot of the skills that we use as doulas, we use in so many different aspects of our life. Like even like with our kids when they get hurt, like teaching them like take nice deep breaths and things like that. So it's like these are skills that like we use in all parts of our life. So
yeah, absolutely.
Yep. That's funny. Okay. I don't know. The next one we might some people might not agree with us, but it's this the idea that like everybody needs to be collecting colostrum before the baby's born. I feel like this is a fairly new thing. This was not really a thing when I was having my kids. Like I had never really heard this.
I've only heard it in classes in my last year or two, maybe. Like I feel like it's
in the last
few years. New.
Yeah.
I heard it a lot when I was pregnant with my my youngest, and she's 3 now. So that's kind of where I heard it, because I didn't hear it with my other 2. And then I started seeing all these people like, when should I start collecting colostrum? How much should I expect? And all these things. I'm like, first of all, why are you doing that? Like, what's the purpose behind that? Why does everyone need to be doing this? Because I haven't heard it from my midwives. I haven't heard it from anybody. So like, why is this so prevalent in social media right now? And I don't know who like introduced that as like a need and why it suddenly became such a big thing. But yeah, it is newer, I feel like. I just don't know why.
Yeah, why everybody feels like they have to do it.
Yeah.
I think it can be a great thing if you know your baby's going to be in the NICU for whatever reason. Or, you know, I think there's just like different scenarios where I think it could be a great thing. We talked a little bit about it on our episode just a few weeks ago with Mary, and when talking about the NICU experience, you know, and like, yeah, that's definitely a great thing if you know that you might need it. Or maybe if mom has gestational diabetes and they know that they're going to be monitoring baby's blood sugar, it might be helpful. But I feel like we have this like big long list of all these things that these, you know, you got to do this before baby's born. And I don't know that that's something that everybody has to do.
Yeah, I'm sure it probably started just from people who were like, you know, I really needed some colostrum because of any of those reasons, because my baby was in the NICU and I really wish I'd done this. Everybody should do this just in case.
Just in case.
Yeah.
But it's like the risk there, like the percentage of babies who end up in the NICU is very, very small. Very small. And the ones who end up in the NICU who cannot nurse is even smaller. So yeah, I never did it for my own kids. I did collect colostrum when I was a gestational carrier, so as a surrogate, because we had already discussed, myself and the parents, that I would nurse the babies in the hospital because that's good for baby and for me, and they were totally on board with that. But I wanted to express colostrum so that they had that to take home with them until my milk came in. And both times they never had to use formula in the interim. They were able to just get what I expressed. But it's really hard work. It is not easy, and it's not the most comfortable thing in the world. And B, I still never would have done it for my own kids.
Yeah. But that was a time and a place to do it. Yeah. Yeah. I wonder
too, if well, I wonder too, like you said, like it's hard and it's not comfortable. And I wonder if that could even potentially set some moms up thinking, oh, I'm not going to be able to pump or I'm not going to be able to breastfeed. Like thinking like this is the experience. If like, and if this is the experience, then maybe I don't want to do that, or maybe I'm not going to be good at it, or maybe I'm not going to make enough milk. You know, like I could see how that could potentially get some parents on kind of a negative train. Because I know that, I mean, just normally, like some women leak a lot of colostrum just in their pregnancy, and some don't. And that's not any indicator of how much you're going to make or anything. It's just variations of normal, you know. So I think sometimes these things that are out there as if everybody should do can potentially have negative effects on a mental capacity, you know, mentally for a new mom, especially a first time mom who's thinking like, oh my gosh, I didn't collect as much colostrum as the lady on Instagram, and you know, am I going to be okay? Is this going to work? And that just adds so much pressure that doesn't need to be added. You know, if, you know, like you guys said, if there's some reason that we think we should do this, then absolutely go for it.
Right.
You know, maybe contact a lactation consultant so that you can get accurate information and good help and, you know, the right supplies and all of that. But yeah,
and talk to your provider too.
Right. Like, yeah. So I, you know, I don't know. I could also see how it could potentially negatively impact somebody.
Yeah. I think that brings up, kind of going off topic just a little bit, but still around breastfeeding, is like with the unrealistic expectations, with like so many moms on TikTok, like they are posting videos of like how much milk they're getting when they're pumping, and they are getting huge volumes, like 8,
we should talk
9,
about
10.
that on part two.
But I think like that's
part 2.
Like while social media is great, it also does have their drawbacks with that. And it's not that like they're sharing wrong information. It's just that like everybody's different. And it's so important to know like what's normal, and just having realistic expectations. So that was a total side note, that something you had said made me think about that. But
yeah, no, I think you're totally right.
Yeah. Okay, the next one, number 4, is kind of that, it's that phrase of once a C-section, always a C-section, and VBACs, and kind of that whole conversation, which we talk, you know, a lot about that. We talk about C-sections and VBAC in our classes. It's included in our doula training, like, because this is so prevalent. There are care providers who believe that, and that's how they practice. It's like, once you have a C-section, the rest of your children are going to be born via C-section. And everybody talks about like, oh, the increased risk of a uterine rupture with a VBAC, but they also don't address the other side of the increased risks of various things if you have a repeat C-section. And a lot of times those risks go up for every C-section that you have. So what are some of the risks? Can you guys kind of list them off?
I mean, one is placenta, you know, abnormalities that they, you know, placenta accreta, things like that, where the placenta attaches like deeply into the uterine wall, trying to get a blood supply. I mean, I think it's so important that you have to have both sides to be able to make an informed decision. And just giving one side it's really unfair, and it feels pretty unethical.
Yeah.
I think one thing, I don't remember where I listened to this. I think it was a documentary I watched recently, but in the way that providers like present the information, because some providers will say, well, your chance of, you know, whatever happening doubles. And that sounds really bad. Like, oh my gosh, my chance of this thing happening doubles, where the number goes from like 0.1 to 0.2. That number doubled, but that doesn't mean that you have this huge high risk of that happening. And that's kind of like, I feel like when they're saying, oh, well, your chance of a uterine rupture increases, it's still below 1%. Like so it's still not a huge number. things like that. And so I just think that giving accurate information is so important. And really looking at what the statistics do say.
Right. And then letting a family make their best choice.
Yep.
Because it depends on so many things, right? Like, if I just want 2 kids and, maybe having a repeat C-section that's planned, and I don't have to, depending on how my first what I decide to do. And, maybe if I want lots of kids, then having C-sections isn't what I want to sign up for, or what I want to try for, you have to have both sides.
Yeah. Yeah. I recently had a mom also tell me that her OB told her that a planned C-section is going to be easier. And I was like, well, I mean, I can see that side of things, but I think we also downplay the recovery aspect of C-sections. Like C-sections are talked about like it's the most common abdominal surgery done in the United States. Like we talk about it like it's no big deal, but it is major abdominal surgery, and the recovery is longer. Like we can't deny that. Like that a recovery from a vaginal birth is going to be harder than a C-section. But like there's providers on TikTok saying like, oh, I would choose a C-section, and I am just like it's yeah.
You know what though? That provider is choosing a C-section with information that they're not giving other people. Like, if you want a C-section, have a C-section, but have all of the accurate information to be able to make the right choice for you, not based on somebody's half truths or half ideas, or like that's all okay, but you can't. You have to be able to make an informed choice for yourself.
Right. And the way that like there's still hospitals that have VBAC bans where we won't do a VBAC. Like, right. They have to be able to make the decision. It's their choice. You don't get to decide that for them.
Exactly. Right.
Yeah. If you want to know about VBACs, I recommend going to VBAC Facts. Jen Camel is like, that's where I tell anybody to go who wants information about VBACs. So, all right. Okay, one more. And that one is that there's this idea, and I know that everybody has heard about it, is that breastfeeding is painful and it hurts. What were you guys told about breastfeeding, like, especially before you had your first?
Well, for me, with my first, I don't remember what I was told prior, but I did have pain. And the thing about it is that, yes, it's common, but it's not supposed to be that way. And I would latch my baby and just be in tears because I was in so much pain. And I tried to get a lactation consultant to come, but they weren't terribly helpful in that process. And I just needed someone to be like, this is not normal. Like, you should not be feeling this way. And like, there's something wrong and we need to figure it out.
Yeah. I was told my nipples needed to toughen up. And
yeah.
So I kept at it with so much pain, like Megan, just thinking, oh gosh, when do they toughen up? Because this is going to kill me.
Yeah.
Well, I took a birth class beforehand, but if they talked about breastfeeding at all, I don't remember any of it.
Yeah.
And so when I was nursing my first in the hospital, it hurts. And they had a lactation consultant on staff. I do not know if she was an IBCLC or if she was just a nurse who had lactation training. But she was only helpful in the sense that she said, if it hurts, you're doing it wrong.
Oh,
well,
so it's your fault.
But then she didn't actually like really help. Like she did the latching for me once and was like, does that feel better? And I was like, not really. And she was like, oh, well, you'll just have to keep practicing.
Thank you.
Okay.
So helpful.
Yep.
Wonderful. Yeah, I always tell my clients that breastfeeding can be uncomfortable, but it should never be painful. Like if you're talking a 1 to 10 scale, it should never be more than a 2.
Yeah, it should be low.
Yeah, it should be very low. And if it's more than that, you definitely need to see an IBCLC.
Yeah. Yeah, I like how Melanie, our kind of like in-house IBCLC that does our breastfeeding class, like she's like it's okay, like if it kind of like they latch on and you're kind of like, oh, that's uncomfortable for a few seconds, but it also shouldn't last the whole feeding. Like you should not be in excruciating pain. But I think because of social media, again, I think there's this idea that like, oh, it's totally normal to have cracked and bleeding nipples, and it's they just have to toughen up. No.
Well, I think that also comes from lack of education from our mothers and their mothers
That's
and
true.
their mothers. Like I think it's I mean, because my mom told me that it hurt. And, like I've had lots of students who come in and say, yeah, my mom told me that, it was going to hurt, but I just have to toughen up. I had one student whose mother told her that she needed to use like washcloths during pregnancy and roughen up her nipples in the shower to toughen them up to be ready for breastfeeding. So I think social media is a problem, but I think it's also lack of information throughout the generations.
Well, because we're still a formula feeding society. When bottles and I'm so glad that we have formula. Like there are definitely like babies and parents that need it, but
it's a tool.
But breastfeeding is different. Breastfeeding and formula feeding, they are two different things. And so very much, I think that's a great point. Like our parents and their parents didn't have good information about breastfeeding because formula feeding rates were really high back then.
Yeah, we're starting to get close to the 100-year mark since formula was created. I mean, I don't have the exact year for that, but yeah, and so it's that many generations because there was that whole campaign about, well, if you have money, you go to a hospital and you buy formula and you do all these things. And I remember my mom saying, she was like, no, I'm so glad that I breastfed all of you, me and my 2 brothers. But she was like, but the fact of the matter is we were poor and we could not afford formula. So really I breastfed because that's what we could afford. But if you had money, I mean, this was in the 80s, the early 80s, but if you had money, you bought formula.
Yep.
So you said,
it's like a social status thing.
Yeah. And then we talk about our culture, and that's going to go onto the soapbox of just how we're not surrounded by birth anymore as a whole. Save that for another day.
Yeah, that's a really good point. I remember with my first, because I saw all my mom breastfed all of us, and I was the second oldest of 6, and so it was like I saw her feed all of my younger siblings, and so for me in my head I was like, well, no duh, that's what I'm gonna do, but at the same time I still had it in my head that like, oh, this is a natural thing. It's just going to come easily. It's not that big of a deal. I had no idea what I was getting myself into. I had my best friend from high school. She had already had, she had one. I think she even had her second by the time I had my first. And I had seen her nurse her kids, and it just seemed easy, no big deal. And man, when we had struggles just a few days in with our first, I was like, oh goodness. So
it's funny you that, because I had the same situation. A friend of mine had already had 2 kids, and she was actually pregnant with her third when I had my first. And after getting home and still being like, this is painful, I don't know what I'm doing, guess who I called? I called my friends who made breastfeeding look so easy, and she's the one who helped me.
Yep. Yeah. And I think we never know what happens behind closed doors, like when I saw my friend breastfeeding, thinking about it now, it's like by that point her baby was older, so what struggles they did go through, I didn't see those, and it's not like she's out telling everybody all of them. I mean, we do, but that's our job, but in most friend circles, it's not the thing to do, but yeah, I just hate that there's this idea out there that It should be, you're right. That idea that, yeah, breastfeeding is going to hurt. It's supposed to hurt. It's normal, you know, like that's not the case. It's normal to be uncomfortable, but if you are in excruciating pain and you are curling your toes and you like dread every feeding, because it's so painful, like there is something that needs to change. And seeing an IBCLC can really, sometimes they're very simple adjustments. But maybe there's some other things going on, you know, that they can kind of help give you the tools for that, you know, to help you figure out what's going on and make it better.
Right.
Yeah. If you can't reach the point where you can relax completely while you're nursing. And that's what I think of, like the first few days and, you know, maybe a week or two in, like you're a little tense because it's still a little bit of, am I doing this right? You know, you may still be helping baby latch a little bit more with those, you know, those micro adjustments, but eventually in the midst of a nursing session, you should be able to just be like, oh, okay, on, we're good. And you should be able to relax and, you know, binge watch something on your phone while you're nursing. Like you should be able to do that. So yeah, that's the idea of that toe curling pain. And I mean, we talk about relaxation and for birth and for labor, but even during nursing, like relax. Tensing up is not going to make it easier, but if you're in pain.
Right. Yeah, there should not be tears. Megan and I should not have been crying.
No, we shouldn't have.
During our nursing sessions.
No.
And thinking, oh my gosh, I have to do this again in 2 more hours.
Yep.
And again in 2 hours.
The dread.
And again.
Yeah.
It was awful.
Yeah. I think just with education, and the more we do talk about it, we should be talking to our friends about it. Like, I think it goes back to that realistic expectations too, of like understanding what normal newborn behavior is. And, you know, cluster feeding and growth spurts and all that kind of stuff of like this is normal. And this is okay for me to sit and rest with my baby and feed my baby. And I won't say it's easy, even for moms who do, like, it looks like it is fairly easy for them. I bet that they're struggling too. And I think that we have this tendency to just be like, oh, this is too hard, I'm going to quit. I don't know.
Sometimes, you know, and then I think there are other people who like feel so committed to it that like, I mean, like for me, like I didn't feel like I had the option to quit. Like I just, because very similar as your mom, Liana, like we couldn't afford formula. And so like our only option to feed the baby was for me to feed the baby. And so my only option was to, you know, that I thought was to just keep doing it and wait for my nipples to toughen up and hope that they did, because I had to do it. I didn't have another option. And what a terrible place to be, especially as a new mom, to feel like that I can't, I didn't know to ask for help because I thought it was normal. And if I would have known that it wasn't normal, I would have known to ask for help and that it could have been a different scenario. So I think you're right that a lot of, you know, like I can't do this anymore, I'm just going to quit. And then I think about the other women like me who are like, well, I have to do this because I have to breastfeed. I can't not. So they're both terrible places for a woman to be.
And everybody feels differently about it, you know.
Absolutely.
You know, I was the type of person who it was something that was really important to me, and so I was willing to pretty much do anything. Like to see the lactation consultants, to do all the things. 2 of my kids were tied, like, but I also share too, like my first one was supplemented with formula for the first 9 months, you know, like, so when people just, you know, start saying I have to supplement, I'm like, it's okay. Like it is okay. And I think we have to be careful with supplementing because we also know that can cause problems, like with milk supply and all, you know, that is a whole other topic, but like, it's okay, you know? So that's probably something we can talk about for forever.
Mm-hmm.
But those were kind of like 5 things that we kind of very quickly came up with a list of. These are just things that we see on social media. We see parents talking about it. You know, the 4 of us have experienced kind of a range of things with all of these. And yeah, I'm sure we'll probably come out with a part 2 sometime in the future too. I think there's probably plenty more.
I think
the more we think about them. I don't know. So if you have been listening, if you like have thought of any like maybe myths or just different things that you've seen on social media that you're like, really, that's not true, we would love to hear about them. So leave a comment, send us a message about kind of all of those things that you're like, that's just not true. Or
we're
if you have
not
a
sure.
question.
You're
Yeah,
like,
I was about to say, or if you're like, really? Yeah, let us know. We would love to hear about them, and maybe we'll chat about them and share our thoughts. So the 4 of us always have thoughts and opinions. Okay.
Yeah.
All right.
Yes, we do.
That's one of the best parts of this job, is talking to you guys just about all the different things that we come across. So anyways, all right, this was fun to chat about all of these. So thanks for listening, everybody. Please, we would love it if you would leave us a review, share your thoughts about these, and yeah, I guess stay tuned for part 2 one day. So thanks, everybody. We'll talk to you guys next week.